Welcome to this webinar on NIH's SBIR STTR Applicant Assistance Program. I think we've got everyone who's going to be joining. So just to let you know, the webinar will be recorded. So it'll be available for folks who want to go back and review it again at a later date. So my name is Patty Weber. I'm a program director at NCI's SBIR Development Center. And I'm going to talk to you today about the Applicant Assistance Program. So just a few housekeeping notes. So if you have any questions, please type them in the Q&A box. And then the speakers will answer the questions at the end of the presentation. We also ask you that you please complete a post-event survey. And here's the link for that survey. It really does help us in putting these webinars together. And if you have additional questions, you can contact NCI SBIR at mail.nih.gov. But I'm also going to be showing you the contacts for all the point of contact program directors for the various institutes that are participating in the Applicant Assistance Program. So these are the 10 participating institutes for the program that will be preparing applicants for the January 2023 SBIR STTR application deadline. So I'm the point of contact for the National Cancer Institute. Yasemin Moghadam is the contact for NHLBI, or National Heart, Lung, and Blood. We've got Taryn Albrecht for National Institute of Neurologic Disorders and Stroke. Joy Tolliver, she's on the line today from the National Institute of Aging. Lily Portilla and Nina Ragapal are contacts for Ncats, and Nina is on the line today. Ravi Ravichandran is the contact for the National Institute of Environmental Health Sciences. And I don't know that Ravi's on, but you can certainly email with questions. Roger Miller is on today from the National Institute on Deafness and Other Communication Disorders. And this is the first time that NIDCD will be participating in AAP. Chris Bowe is, I don't believe Chris is on, but you can email him with questions, and he's the point of contact for the National Institute of Nursing Research. And then Claire Cheng for the National Institute of Child Health and Human Development, and Janica Patterson for the National Institute on Alcohol Abuse and Alcoholism. So I'm going to just briefly cover about SBIR and STTR, about the programs. So these are both congressionally mandated. SBIR stands for Small Business Innovation Research. It's a set-aside program for small businesses to engage in federal R&D that have the potential for commercialization. The federal agencies that have an extramural R&D budget over $100 million must set aside 3.2% of their agency budget for the SBIR program. And you can see on the right side the participating agencies. And the STTR program, or Small Business Technology Transfer, and that's a set-aside program that helps to facilitate cooperative R&D between small businesses and U.S. research institutions, again, for projects that have the potential for commercialization. And for the STTR program, the federal agencies that have an extramural budget over $1 billion must set aside 0.45% of their budget, their extramural R&D budget, for the STTR program. So in FY21, these programs represented about $1.22 billion at the NIH alone. It's a three-phase program, so you are going to be assisted if you're accepted into the Applicant Assistance Program for Phase I, for just a Phase I application. And so what is Phase I? It's intended to fund a proof of concept. It's 6 to 12 months, and again, AAP eligible for Phase I. But if you're successful, you can come back and apply for a Phase II application. And that's typically a 2-year project, and it funds additional research and development. And in a Phase II application, a commercialization plan is required. We also have at NIH a direct to Phase II. So if you've done the equivalent of Phase I work with other funds or your own funds, you can skip Phase I and come in with a direct to Phase II application. And then NIH, NCI, and many of the other NIH institutes have what's called a Phase IIB program. At NCI, we call it the Bridge Award, and it's intended to fund technology validation and possibly more clinical translation of your work. And we do expect that applicants to the Phase IIB program secure substantial third-party investor funds. And at NCI, we allow up to $4 million in over 2 to 3 years. When you get to stage 3, this is the commercialization stage, and there's no use of SBIR, STTR funds. So that table at the bottom shows you the standard budget amounts for Phase I and Phase II. And then the middle line, the hard cap, this is a congressionally mandated hard cap. But each institute at NIH has waiver topics that were given to the institutes by the Small Business Administration. So you can go over these budget caps, and they do vary by institute. For example, at the National Cancer Institute, we cap Phase I awards at $400,000 in total costs. And for Phase II, we cap them at $2 million in total costs. But again, check the waiver topics for the institute that you are interested in applying for. And so what is the NIH Applicant Assistance Program? So this is a free application preparation assistance program. It's 10 weeks in length. And if you're accepted, the program goal is to provide a mentor for the participants that have a great technology, but they have little NIH experience and limited experience in your network. So this application period is open today, and it's closing on September 22nd at 5 p.m. Eastern time. So make sure you make a note of that. It's 5 p.m. Eastern time, not your local time. And I've provided a link here to the application program. So what does it provide? It provides Phase I SBIR or STTR application preparation support and review. It's not going to provide you with a grant writer. You will get specific aims page review and advice, but the program does not provide you with research plan development that you have to do. You will get submission process coaching, but the small business is required to do all the registrations, and then all of the other, there are several registrations that are required. You'll get some advice on that, but they will not do it for you. So of the 27 institutes and centers at the NIH, I have highlighted in red the 10 participating institutes. So the AAP timeline, we have 3 cohorts per year. So the cohort that you will be applying for, hopefully, again, it's open now with applications due September 22nd. So this cohort will prepare you for the January 2023 deadline. And then the next cohort prepares applicants for the April 5th deadline, and that course takes place between January and April 5th of 2023. And then there's a third cohort that prepares you for the September 5th deadline, and it starts in June and goes through the end of August, early September. So how are you eligible for AAP? So they're very simple. You had to have no previous NIH SBIR or STTR awards granted in the past 10 years. So we are particularly interested in applicants by individuals that are currently underrepresented in the biosciences, although this is not a requirement for the program. But we do encourage women-owned and run businesses, minority-owned and run businesses, and businesses operating in an underrepresented state, or we call these IDEA states. And these are the recognized IDEA states. And you can just Google that term and you'll find this map. Several websites have it. So the AAP application is pretty simple. And I would encourage you, if obviously you're at your computer, if you're on this webinar, is to go to the portal now. And so what you're going to be asked to do is you're going to answer a series of structured questions, and you're going to be able to upload some supporting documents, for example, the abstract. And again, I'm highlighting here, the deadline is Thursday, September 22nd at 5 p.m. Eastern. So what are we looking for? Again, in the application, we're looking for the abstract, where you're going to talk about the unmet need. You want to make sure that your technology is clearly written, and then how the technology fits, the mission of the institute that you're applying to. And then you want to make sure you discuss that your technology has a realistic commercial potential. What's the current state of your technology? And I'm going to go through each of these sections in more detail in the next slides, but you're going to talk about a brief description of the preliminary data, what milestones are you currently working on, and then what milestones are you seeking SBIR or STTR support for. But I want to start with the project title. So this is part of the application. You're allowed up to 200 characters, and in the title, you should briefly inform the reviewer of the essence of the project. In other words, this title, should convey what you will do and how you will do it. And, use words in the title that fit the mission of the participating institute. For example, if your project is cancer related, use the word cancer in the title or the type of cancer that your technology focuses on. And the technology innovation section, and this is for the Applicant Assistance Program application. So in that section of the application, we want you to describe the innovation that will be the focus of your SBIR or STTR project. We want you to describe the problem that you're trying to solve with your technology and why it needs to be solved. So you want to be convincing regarding why your solution is the best. We want you to briefly discuss the technology features, what makes your technology better than competing technologies that might already be on the market or might be in development. And then if you have a patentable or already patented technology, you want to describe your intellectual property. So if you haven't patented yet, describe how you will protect your intellectual property. And then you might want to discuss your freedom to operate. So there's a question called the unmet need. Here, you want to, again, describe the problem you're trying to solve and how your technology will improve human health. So remember, all of the institutes at NIH and the 10 participating institutes, they each have a mission, and they're focused on human health for a particular disease area. So NCI is cancer. So you want to describe how your technology will improve human health that comes under the mission of the participating institute. So you want to be concise, you want to be specific, and you want to be quantitative. So describe what population is affected by the problem. And then what would be the desired outcome that your customers would expect if the problem was addressed. So you do have to think about the customers for your technology when you're writing this section. And then the fit within the NIH Institutes and Centers mission. So here's where I talked about the mission. So here you are allowed up to 1,500 characters. And remember, you can only apply to one of the 10 participating institutes or centers. So not every institute or center at the NIH that has an SBIR or STTR program is participating in AAP. So you have to make sure that you apply to one of the 10 participating institutes or centers. And again, explain how your project fits within the mission of the institute or center that you are applying to. We have had cases where an applicant applies to one institute and they think it fits with that institute, but it actually fits better with another institute. So there have been instances where we've transferred your application to an institute that has a better fit. But do your best at reviewing the mission of each institute. Each institute has a website, so you can go to their website and there will be a mission statement. And then if you have further questions about the fit, I want you to contact a point of contact individual. And you'll have those emails are on the slide, and this whole slide deck will be available to you, so you'll have that information. So again, each institute and center has a mission statement. Go look at them. So for example, NCI's mission is to lead, conduct, and support cancer research across the nation to advance scientific knowledge and help all people to live longer and healthier lives. This is a very broad mission statement. So this means that NCI will fund research at any stage along the cancer continuum, from prevention, diagnosis, treatment, survivorship, and end of life. And we cover every technology that you can imagine, from digital health to therapeutics, diagnostics, imaging agents, and devices. So just be sure, again, to look at the mission statement of the participating institutes. So there's a section of the application that asks you to describe the current state of your technology. Here you get up to 200 characters. You want to say if it's a concept that you have, that's fine, talk about that. If you already have a prototype, state that and then describe your prototype briefly. Have you tested your technology with potential users? You can, describe a couple of sentences here about what you've done. Have you completed in vitro or in vivo testing? So you just want to, you don't have a lot of room here, but just briefly describe the state of your technology. And then you want to, this is a question that asks you to describe the premise that supports the scientific rationale for your proposal. In other words, what is the evidence that your idea for a product or service is valid? So describe that evidence that you have. If the premise is based on scientific literature or another source of public knowledge, just make that clear and then describe what that is and the source. If you or a collaborator have generated preliminary data, make that clear and describe it. But please do limit this section to 1 page or less. You can include tables or figures if it helps to present the data, but do keep it to 1 page or less. Then there's a question that asks you to describe your NIH SBIR STTR Phase I goals and milestones. So here you have up to 3,000 characters. And we want you to describe the scope of work that you're going to complete in this Phase I SBIR or STTR project. So keep in mind that a Phase I grant timeline is 6 to 12 months. It's automatically 12 months for an STTR, but for an SBIR, it can be as little as 6 months, but as long as 12. We want you to discuss the goals and milestones that will be accomplished with the grant funding. So in the grant language, these are called specific aims. So a specific aim is a concise statement of what work the grant will pay for. So remember that SBIR and STTR grants specifically support product development. They're not intended to expand on existing knowledge in the field as you would do with an academic grant. You really have to focus on what work needs to be done to advance your product or your service towards commercialization. Phase I is meant to fund feasibility, but some applicants already have preliminary data, and that's great, so you should describe it in your AAP application. But if you don't have preliminary data, you want to provide supporting evidence for the validity of your technology using previously published data or other information in the public domain. But you definitely want to describe in this section what you would like the grant to pay for. So those are your milestones, or what we call specific aims. And this is a question asking you to describe your strategy to protect your technology from competitors. You have up to 500 characters, and here you can, describe your provisional or your patent application. So you just refer to the fact that you have them, you've applied. Maybe you can provide a patent number. Maybe you could talk about the fact that you've got copyrights or you've got trademarks on your technology. And if it's a trade secret, you can describe that it is and why you felt that trade secret was the best approach to protect your intellectual property. So what comes next? We are going to have another session where we'll be available This is going to be what we call the AP office hour. It's going to be on Thursday, September 15th from 2 to 3:30 Eastern. And we need to put the registration, maybe if it's available, we can put it in the Q&A, or we'll have it available on the Eva Garland's AP website and at NCI's website. So please do make sure you come back for the office hour, because I want you to go through this application as soon as possible and try to get through these sections that I've just finished describing to you, all these questions that you're asked in the AP application. And you need to come back to the office hour to get your questions answered so that you can submit the best application. We've had some, what I think were good technologies that were thought of in the AP application, but the applicants just didn't give us enough information for us to review and determine if we should accept you. So the reviewers for these applications are the scientists at Eva Garland, who are the mentors or coaches for people that are, or companies that are accepted to participate in the AP, and then also the program directors that manage the programs at the participating institutes. We're the reviewers. So we need you to give us as much information as possible so that we can evaluate your technology in order to determine if we can accept you into the program. And I want to thank you. And I just want also, we'll be ready to take questions in a few minutes, but I just want you to know that, again, type your questions in the Q&A box. And if one of your questions is for a specific institute or center, please specify that in the question. But I do want you to know, again, all the point of contact individuals. But I'm not going to go through these because I want to take more time for questions. But all of these slides are going to be available to you. So all of the institutes have their priority areas listed on these slides. And if somebody has a question about a specific institute, I can go through and pull up these slides. But all of the institutes participate in what's called the omnibus solicitation. So there's both a clinical trial not allowed and the clinical trial required omnibus for both the STTR and the SBIR program. So all the institutes participate in the omnibus, but many of them have specific targeted funding opportunities. And that's something, if you're accepted into the program, your coach will go through that with you, which would be the best funding opportunity for you to apply to. So again, all of these slides, I'm just going through them quickly, are going to be made available to you. So I'm going to go back to the slide with the contact in case you have a specific question for participating institute or center. So now you'll be able to see all of the participating institutes and centers. So I think we can go ahead and go to the questions. So I see a question here. It says, I'm a co-investigator on an STTR. Am I eligible? It's the company needs to apply. The company that's applying for the STTR needs to apply to the Applicant Assistance Program. So if you are considered, a co-PI, you're part of the application, you definitely want to work with the company that's applying for the STTR. But we do allow the teams that are working on either an SBIR or an STTR to be on the calls with the coaches if you're accepted into the program. So I would say yes, go ahead and apply. The next question is, I'm preparing a fast track proposal for Ncats. Is the AP helping with both phase 1 and 2 or just phase 1? AAP is only helping with phase 1. So if you are intending to apply for a fast track, you are not eligible to apply for AAP. So it's phase 1 assistance only. The next question is, are we going to have a copy of this presentation? Yes, absolutely. And that's why I did go through those last slides very quickly, because I wanted to be, available for questions. I see a question, is it possible to have the application to AAP reviewed? It's not possible for us to do that, but I recommend that you have, anyone that you're collaborating with on an SBIR or STTR application. You should have them review it, or if you have others at your company who are familiar with your technology, you should definitely have someone else look at the application itself and go through your responses to all the questions to see if they understand it and whether or not they think you've thoroughly answered all the questions. So this question is, if the innovation can be applicable to multiple NIH, so it's not NIH, it's not agencies, they're institutes, out of the 10, could we put several of them in our AAP application? You need to select one institute that you're applying to. So again, I encourage you to look at the mission statement, and if you're unclear about which institute your technology is the best fit for, let's say you're down to 2 or maybe even 3, then you should email the point of contact person for the institute and just tell them a little bit about your project and whether or not this fits their mission, and they should be able to answer you. It says, if your division was not listed, should you still apply for AAP? Unfortunately, no. If you need assistance and your technology doesn't fit the 10 participating institutes, then you should not apply for AAP. I know that the National Institute of Allergy and Infectious Diseases has their own program. So if your technology fits their mission, you should go take a look at NIAID, and they offer Phase II application assistance. Another question about if the topics that pertain to my technology cross over between NIA, NINR, NIDDK, NIMHD, do I apply to this AAP? So you can see that NIA is participating, NINR is participating, NIDDK is not, NIMHD is not. So you need to focus on your technology and how it applies best to either NIA or NINR. So this would be a situation where you might go ahead and email the point of contact person. Do we need to establish a company before submission? Yes, you need to have a company. You don't necessarily have to have all those registrations in place, but that's something you're going to be told to work on immediately if you're accepted into the program, because some of these registrations can take some time, and the application deadline is January 5th. Do you have to have an academic institutional partner for an SBIR Phase I? No, you don't for an SBIR. It's the STTR program where it's really intended to fund technologies coming out of academic institutions. But if there's a part of the work that you need to have done in a Phase I SBIR, you can certainly work with an academic institution to do some of that work. You can also work with the contract research organization. Next question, does the company need to be legally incorporated prior to AAP or just prior to SBIR submission? You do need to have the company formed in order to apply for AAP. Here's another question. Aside from the one-pager on the premise that supports scientific rationale, are the answers to all of the other questions entered into text boxes during application submission? Should we worry about formatting and creating PDFs? So some of the answers you enter directly in the application, and others you can upload a supporting document, and the application portal will clearly tell you which of those you can upload a supporting document. And I don't know that there are specific font or margin requirements. I don't know if there's somebody from Eva Garland that's on yet that could answer that question.
Yes, Patty, this is Tiger. I can definitely answer this question. So there's no font size or anything requirement. There is character limits on most of the questions. The only PDF you need to upload is a one-pager describing your technology, the predictive data premise. Then make sure you only upload one page, document. Previously, there are some applicants upload a manuscript, so it will be very hard for the program officer here and also the reviewers to review the documents. So make sure it's a one page.
Thank you, Tiger. Here's a question about, it says, if my institution has designated my company as an institutional startup CNA, can I be my own partner for an STTR? So the company is the applicant, always, for both SBIR and STTR. So I'm guessing that what you're referring to, kind of be my own partner. So the PI in an STTR can be a company employee or remain in their academic position and full-time and be the PI for the STTR. And in that case, it depends on institutions and their conflict of interest agreements with professors, whether or not they allow you to be the PI and then have funds come back from the company to your laboratory to do some of the work. But that's really the goal of the STTR program, is to bring technologies out of academic institutions. So yes, you can be the PI. And I guess that's what you mean by own partner. And work can be, there can be a subaward back to the academic institution to do some of the work. The next, and please let me know if that question wasn't adequately answered. Maybe you could send an email. The next question is, since the pandemic, many companies work virtually from home. Does it require a physical office space to apply to SBIR? Well, it really depends on the nature of your work. I think it's certainly easier for companies that are developing software solutions to have everyone doing their work from home. So it really depends on the nature of the work that needs to be done. If there are, bench experiments that need to be done, then I would definitely recommend that you, rent incubator space, and you don't have to have any rental agreements to do any of the work that you're proposing in place at the time of the application. It's only at the time of award. So you definitely want to describe what the physical space is where the work is going to be done. But if you're a company that's developing a software solution, you still need to have physical space. So you want to describe, what that physical space is. So if you have several people, working from home, you probably still need to have a main company address, and then you talk about your key personnel and where they work from and what kind of equipment you have to get the work done that you're proposing in the grant. Next question, what do you see as some key distinguishing features of the most successful AAP applications? Well, it goes back to what I said earlier, is we've seen some applicants come in with what we think might be reasonable technologies, but they just don't give us enough information to determine if the project, or if the company is one that we want to support through AAP. So it's really all about trying to answer those questions in the application as thoroughly as possible. So, describing your technology and the unmet need and what your innovation is, and certainly any preliminary data that you have, you want to describe that, and then going through the what I call the milestones, or the specific aims. What do you want the grant to pay for? Be as specific as possible in those sections, all the sections of the application. This question is in regard to our AAP applications reviewed on a rolling basis. Is it in my best interest to turn it in as soon as possible? Most of our applications come in towards the end of the period, so it doesn't really benefit you to turn it in as soon as possible, but we only have the 3 cohorts, so we only have applications open for these certain time frames before we select participants for a cohort that is going to prepare you for the next application deadline. So that only happens 3 times a year, so we don't have a rolling applications for the whole year. So take your time would be my best advice here. Just take your time and put in a good application when you're ready before the September 22nd deadline for the next cohort. If you don't make the next cohort, there's another one coming up for the spring.
And also, Patty, I want to
go ahead.
Add a few things is feel free to go ahead, start it working on your answers to this question offline and save it, on your computer. Tweak it, take the time when the portal is open. The close of the portal is on September 22nd, so you have quite a long time to prepare your answer. And I totally agree with what Patty said. Start working on that early. There's no rush to submit it early, but make sure you have very good and quality answer to all of those questions.
Yes, and if you start working on it early, it should prompt you to have more questions to come back on the 15th of September to our Q&A office hours, so you can get those questions answered before you submit. So the next question says, as a software developer, I use Amazon services for computing power. Are we allowed to allocate funds to these services? Yes, that's certainly something that would be considered a direct expense. So that would be put on your budget as a direct expense to the company. I plan to be a co-PI on the SBIR grant application, but I won't be the lead PI. Can I be the applicant for the AAP? I would say yes. Again, the company is the applicant to both the SBIR and the STTR programs and to the AAP, but you just want to describe what your role. And if you want to add to that, Tiger, go ahead.
Yes, so make sure the people who apply to AAP represent the company. So, if you are the co-PI, not the lead PI, but make sure you represent the company who is the applicant and participant of AAP.
So this question is, I can see on the portal there's a question, will a university be affiliated with the project? What's the definition of affiliated? For example, if we'll be leasing space from a university or paying for use of the core facility, is that considered affiliated? I think that's affiliated. Would you agree with that, Tiger?
That question is asking whether you are going to have a subcontract or subaward. For STTR, there's a requirement. For SBIR, it's not required, but you might choose to have a subcontract or subaward with a university affiliate university. So if that's the case, you will select yes.
Thank you. Are there any past applications available as samples? There are not. That's not something we've made available. We do have. There are lots of SBIR and STTR applications, so you can at least go and look at those to see what the specific aims page would look like, or that question that asks you, to describe the milestones that you want the grant, the grant to pay for. So that I don't know. I don't have the application open. What's that exact question number? So the question that asks you to describe your NIH SBIR STTR Phase I goals and milestones. So here's where, if you were to go to NIAID has sample applications. NCI has some sample applications on our website. Maybe somebody could put links to those in the chat. And those would be a good place to look to see how that question is answered. This next question is, does round 3 SBIR applications have a high number of acceptance? I'm not sure exactly what that question is asking.
I want to make sure it is not about AAP application versus the SBIR grant application.
Yeah.
So I can speak of the acceptance rates for AAP, which is not, we are not actually able to predict because the application numbers for AAP program varies a lot across the cohorts, and also, you know, the January, you know, for the next January cohort is really hard to predict that. But I can tell you the acceptance across many cohorts in previously ranging between like 40% to 100%. So it's really like, you know, a high you know, variability out there.
Yeah, I can add, you know, the larger institutes like NCI, we pay for more slots because we get more applications in general to our program, to our SBIR. So we figured, you know, we're going to get more applications to AAP. And so I think our acceptance rate is about 40%. Maybe less, but it's pretty high. And so if you don't get accepted to the first cohort, and you can come back and apply again. Since I don't see any more questions, I see Mina has put a link to the sample applications in the chat. So, you know, be sure to take a look at those to help you answer that that question about Phase I goals and milestones. So maybe, since I don't see, oh, here's my, are there any restrictions on the use of biomedical imaging data from the NCI? I assume if, I guess I'm not, maybe I shouldn't assume, are the restrictions on the use of biomedical imaging data? I mean, if there's publicly available data, then I assume you can use it. I don't, maybe could you try to clarify that question? So I see a question, if my business is applying for an SBIR and would like to have research conducted with an academic medical entity, but that entity is not identified at the time of AAP, do I still include that? Well, yes, you should include that, and that you don't have to have your partnering, you know, academic or medical entity identified at the time that you apply for AAP, but you should, you know, still talk about the fact that you're going to need to work with those kinds of entities to do some of the work that you're going to propose in the SBIR application. Anybody else that wants to, you know, add to that? Maybe Joy?
Well, this is Tiger. I can also chip in for this question. This is why we want you to answer the question: what is there a academic or university affiliated with your application? That will be yes. You don't actually have to identify at the time of AAP application. During the AAP, your coach will guide and coach you how to, you know, work with the academic office to set up the appropriate subcontract subaward.
Thanks, Tiger. let's see, or yeah, I'm wondering if the person asking about the biomedical imaging data, could you just give a little bit more detail? I'm just thinking if there are publicly available imaging data that helps to support, the premise of your application, I would think that you could, you could refer to it. I need to use data such as data from the Cancer Research Data Commons. So you would I assume you would be using those data in the work that you're going to propose. I mean, as long as you have access to those data, if it's a database that's freely available, then I don't see any reason for any restrictions. You would just describe the data that you're going to use and what the source is. And I mean, if you do have to have approval for the use of any source of data, then you should include that in the application. Okay, this question says, do we need to have IRB approval or application at the time of applying to SBIR? You don't need to have that in place at the time that you apply. You want to talk about the fact that you would need IRB approval or would need an IRB application at the time you're applying, but it doesn't have to be in place until you're selected for an award. And so that happens, several months later after review and internal reviews. So no, you don't need it at the time you apply. It says, can an academic medical entity apply for the AAP, or do we need to partner with a small business? You do need to partner with a small business. So the small business is always the applicant and the recipient of an SBIR or an STTR award. So again, while I'm waiting for questions, I'm just going to kind of go through these slides, just to remind you, what the institutes are looking for. So you can see from this slide that, NCI's portfolio, we cover a lot of different technology areas, from therapeutics to in vitro diagnostics, imaging, cancer control, epidemiology, NANDS. These are their priority areas. I'll just leave this slide up for a few minutes while I'm looking for more questions. So I see a question says a member of the Eva Garland consulting team is assigned as the program coach to each participating company. Is that correct? Yes. So it's not the NIH program directors that are your coaches. It's the Eva Garland consulting team. Now, if you are selected to participate, you will be assigned a program director from the participating institutes, and there will be a time where you'll schedule a call with them along with your coach to go over your specific aims page. Another question here, what is the grant award rate for the companies that have participated in the AP? Since we've been running the program, I don't know that we have an actual rate, but we have certainly seen an improvement in the ability of applicants who have never applied for SBIR, STTR funding before, or maybe they have applied and their application wasn't discussed. So we've seen an improvement in getting applicants into the discussion range, which actually is a big deal because for any study section, about half of the applications assigned to that study section are triaged and not discussed. So we do know that there's an improvement in the applications that are submitted by AAP participants. And keep in mind that most people that do submit do need to submit again or resubmit. So, but we want you to know that what this program offers you is a clear pathway for how to prepare a good application. This question asks, would a proposal be rejected based on budget? It could be. The reviewers will comment on the budget, so you do need to look at the budget caps for each of the institutes, and then look at those budget waivers and how much each institute allows you to go over the congressionally mandated hard caps. And this goes on to ask, could we be notified and advised so that we can adjust to a small scale of the proposal? Your application won't be rejected outright by the Center for Scientific Review if you go over the budget cap. It'll still be reviewed, and the reviewers will comment about the budget. And then if your application really has merit and it's considered for funding, but you've gone over the budget cap, then you will be contacted if we want to fund your grant and we will ask you to reduce the budget. So that does happen. Are there any other IC representatives that want to talk about what happens in your institute when an application comes in that's over budget?
Patty, hi, can you hear me now?
Yes.
Great, sorry. This is Joy from National Institute on Aging. I just wanted to add that at least for the NIA, if you are considering a waiver topic, we strongly encourage you to reach out to us to discuss that first to get feedback.
That's really good advice, Joy. That's correct. You should do that with all the participating institutes. Even though you think your work might fit one of the waiver topics, you do want to talk to a program official about that. And then if it's agreed that you should, you can go up to the cap. You want to be sure to mention that at the beginning of your budget justification section, that your technology fits the waiver topic, list the waiver topic, and then go on and complete the budget justification. And you can even mention that you spoke with a program official about going over the hard caps. Someone's asked, please let us know where to get the slides for the presentation. They're very important. So these, the slides will be mailed out, I guess, in a PDF format to everyone who registered. And then the recording will be, can someone put a link to where the recording can be found? We do have previous recordings of previous AAP webinars at, I'll just find that on the NCI's website. So I'll just put that link. I just put a link to the AAP program and it's on the NCI SBIR website. So it looks like there's a question that's in the chat. So let me look at that. It's a question or comment that says, NIH last month following a question I had during a webinar on NIH resources for early stage companies. They replied to you that you deem my technology novel, which I could provide as proof for your AAP program. Would this matter, as I've never applied for any SBIR, STTR? So you would want to describe in the application why your technology is novel. Don't use that comment as proof that it's novel, but really describe why the technology is novel. Okay, I just put up so you can look a little closer, the NIH SBIR Small Business Program, the breakdown of their funded, the technologies that are funded in their portfolio. So there's a question here that says, during AAP, would the agency program director give us some hint if our innovation is competitive enough among other SBIR applications? So when you have, if you're accepted into the program and you have the appointment with your assigned institute program director and your Eva Garland AAP coach, and you're going to be going over your specific aims page. So part of that aims page is you need to talk about your innovation. And so that's something that, yes, during that session that the program director can, you know, they can tell you if they feel you've given enough information about the innovation and whether they feel that it's enough information that, you know, reviewers will be able to even make a determination if your technology is innovative. And they can certainly, the program director can, you know, comment on, you know, kind of what other applications they've seen over the years in your area and whether they really think that it's novel. So you definitely want to use that session with the program director to, you know, to ask questions, to, you know, get some questions answered that you have about your application and your technology. But don't forget to talk about it in your AAT application because we want you to get into the program. So here's a slide showing some of the, you know, interest areas for Ncats. And again, National Institute on Aging shows the research priority areas for them. And then this is a new institute that's participating for the first time. And a little bit about the kinds of things that NIDCD will fund. Am I missing any questions? Is autism part of NIDCD? Roger, can you answer that question?
It wouldn't necessarily be part. It would depend on the details of the application. So I'd ask somebody to send me their specific aims and we'd figure it out.
Hi, this
Okay.
is from NICSD. You're talking about autism. Autism is one of the topic of NICSD's interest.
Great. Here's there. And so be sure to email Clara if you have further questions about your project related to autism. Thank you for chiming in, Clara.
My pleasure.
So the next question is, how can you convince reviewers that fusion genes were inherited from their parents because everyone has believed they are somatic? Anybody have an answer to that question? I don't, but I guess my advice would be to talk to your collaborators, other key opinion leaders. How would you write this in your proposal to convince reviewers, and how it relates to the technology that you're developing and why it's important. So this slide shows you the research focus and interest of the National Institute on Alcohol Abuse and Alcoholism. And any questions for that institute, email Jenica Patterson. So that was the last slide for the Institute focus. Oh, sorry, I didn't leave this one up for a little while. So this is the National Institute of Environmental Health Sciences. And you can see they cover lots of different technology areas related to environmental health sciences. I'm not seeing too many more questions. National Institute of Nursing Research is what their interest is. So be sure, if you have a question for any of the participating institutes and centers, email us. Next question, if the proposal accepted and the government cuts the budget on SBIR, would the proposal budget be cut? Oh, so I think your question is referring to the reauthorization of the SBIR and STTR programs. That's, it's coming up. I doubt that the overall budget for the NIH will be cut, and that is what determines the budget for the SBIR and STTR programs. So I think you're asking if for some reason Congress did lower the budget for the NIH, would the proposal budget be cut? Probably not, because if you propose an application that's within our budget cap, we generally don't cut the budget. But if you go over the cap, that's when we ask an applicant whose application we've accepted to cut their budget back, or recap it at our cap. But it would limit the number of new applications that we can fund if the overall budget for the NIH were to be lowered by Congress. Any more questions? Well, I hope that you are taking the time right now to open up the application at the portal and take a look at it and start working on it as soon as possible so that you can come back on the 15th of September and get your additional questions answered because we want to give you the best chance to get accepted into this great program that's going to help you, prepare the best application that you can. So somebody's asked only the 15th. So there will only be one more question and answer session on the 15th. But if you do have a question and you can't make it on the 15th, please do take the time to email either myself, me, Patty Weber. I can answer, I'll help you with anything. If I can't answer a question and I know it should be answered by Ravi at NIEHS, I'll send him your email and ask him to address your question. But if you know what institute your technology fits, I want you to, and you have a question, email the program director. That's the point of contact for each of these participating institutes. So try to get your questions answered so that you can apply to the appropriate institute. When you apply for AAP, you want to designate which institute you're applying to. So you want to get that right. And you want to make sure you find out if your technology is appropriate for that institute. So yeah, we are available to take your questions anytime via email. But you're welcome to come back on September 15th from 2 to 3:30 Eastern. I'm thinking maybe Tiger, do you have any words of wisdom for people considering applying?
Yes, I'm trying to figure out to put the contact email for nih.aap@evagarland.com in the chat. So this is the email. You can always reach out to the EGC AP management team if you have any questions with the submission portal or information, in the application form. Feel free to reach out to us. Any issue when you work on the submission portal, you can always reach out to us through that email. Again, that's nih.aap@evagarland.com. Maybe Bryce, you can help put it in the chat. I had some hard time to find out how to do that. Again, I agree with what Patty said. Go ahead and take a look at the submission portal. There's a lot of information there about AAP already. Then I saw a question about related to 10-week program. There is a schedule list on the AAP webpage. It gives you a rough idea about how this program is scheduled. So please take a look at that. Any question, feel free to reach out to us. Again, anything related to your specific projects, here is a list of the program officers' contact. They are definitely happy to help answer all the questions to their SBIR program.
I just put a link to the application portal in the chat. And remember, the deadline is on the 22nd at 5 p.m. Eastern, not 5 p.m. Pacific or 5 p.m. Mountain or 5 p.m. Central, 5 p.m. Eastern. I just put another link to the Applicant Assistance Program. This is Eva Garland link that talks about what happens during each week of the program. So it gives you the full 10-week outline. And the contact information, if you have questions, is at the very bottom of that information page, nih.aap@evagarland.com. Questions come in, is artificial intelligence an area of interest among all funding centers? I can answer for NCI. I've seen plenty of applications where artificial intelligence is used, and it's incorporated in some ways in the applicant's technology. I mean, it can make possibly your technology more innovative if AI has maybe never been used in that area before. I don't know if anybody else wants to comment about the use of AI. If anybody's commenting, I can't hear you.
I would say NIA definitely has an interest in this area and has seen an increase in applications that are incorporating AI in addressing various different needs of older adults, social isolation, care coordination. So we're very interested in technologies that are incorporating artificial intelligence and machine learning.
Great, thank you. Anybody else want to comment on the use of AI? Any other questions, or are there any program contacts that, if you want to spend any time on what your institute is interested in, I can go to your slide and let you talk for a few minutes. Anybody? Any takers?
So this is Clara from NICHD. I just would like to say that I didn't put much of anything on the slide, just because NICHD cover a wide variety of topics. Yeah, and so it ranging from like women's health issues, reproductive issue, like pediatrics issue, and then child's educations, and also like including the autism we are talking about earlier, even like a child or trauma. And also NICHD has NCMR that is for rehab study. So the best way, it will be to contact me if you think you have any topic for within this variety of topics, and then I can make a determination and tell you whether NICHD will be the right home for your potential AAP project or your future SBIR, STTR applications. That's all I want to say. Thank you.
Great, great. Thank you, Clara. That's always helpful. Roger, since NIDCD is new, would you want to say anything about what you see in terms of applications, what you're interested in at NIDCD?
We have the strategic plan up there. I think that might be useful. People can type in their different research interests into Matchmaker. You can Google the NIH website and see if it gets directed towards NIDCD or another different institute. Something that has to do with hearing healthcare or the vestibular sense, a balance, not falling over necessarily, but this vestibular sense of balance, that would come to us. We're kind of a unique institute in that we have 7 different mission areas, and where we fit in amongst the other ICs can be a little bit tricky to figure out. And that's where the Matchmaker tool can be a big help to you. If your project's going to deal with voice, speech, language, not diagnosing other disorders based on someone's voice, but treating disorders of voice, not treating swallowing disorders, but treating disorders that affect speech, then it would come to NIDCD. And as you heard in the exchange earlier, where we have a place for your research here at NIH. It may not be NIDCD, but we will help you find the right IC. We also deal with taste and smell. That tends to be a smaller portion of our SBIR STTR research program. What we're really looking for here is new ways to address unmet needs or new technologies that substantially change, that are disruptive, just substantially change the way we exist current diseases. And you can look through the database of funded awards here at NIH to find what we supported in the past. That doesn't mean you want to do a similar project to what's been done in the past, because of course that technology has already been developed and is probably on its way towards commercialization. So if you want to get a flavor for what NIH is interested in, there are a couple web tools. You can look at previous awards, but we're really very focused on innovative technologies that can be commercialized. Thanks for the chance.
That was great. Thank you. And that was some really good advice for, all the participating ICs, is to use the NIH Reporter database and, look to see what's been funded by the various institutes, and in particular, the participating institutes. I'm going to put
Patty?
a link. Yes.
This is Meena, and I would like to speak for Ncats. Just to let the potential applicants know that Ncats is a little different from the other institutes of the NIH. And what I mean by that is, we are not focused towards a particular disease or a body part, but then we do promote research that typically identifies and mitigates a bottleneck in the translational science pipeline, which would then ultimately result in the development of more treatment options being available to all patients more quickly. And this is our Ncats mission statement. And I know it's a mouthful, but pretty much I want to say that, our research interest would fall under 3 buckets. One would be the preclinical drug discovery and development, biomedical, clinical, and health research informatics, and clinical dissemination and implementation research. And if you go to our website, you can pull up information on what is included under each of those topics. And if you have any additional questions about alignment, how well your project is aligned with that mission or interest, please reach out to me. More than happy to discuss the fit, and at the very least, I would definitely connect you with my colleagues at the other ICs who might be more interested in your project. So that's what I wanted to say about Ncats.
Thank you, Meena. That's always very helpful. Thank you.
Sure.
Looks like this question is being answered. This is, could application of AI be funded in a clinical application instead of developing new AI algorithms?
Yeah, Patty, I think I was going to type the answer, but I can chime in. I think I understand what the question is, and the answer would be yes. We are interested in AI in terms of in a clinical application. For example, predicting disease or conditions, or risk a robotics in a clinical application, tailoring therapeutics, screening, and incorporating artificial intelligence as well. So yes, we are very interested in that as well.
Great, thank you.
And I would like to say that Ncats would also be potentially interested in the AI platform technologies and tools, specifically, for instance, say, you're developing predictive models for translational sciences, or, if, there are other tools to, developing tools to assess algorithms developed with artificial intelligence and machine learning. So that's something that Ncats would definitely be interested in.
Perfect, thank you. Any other questions? We've got about 5 minutes or so. Gonna go back to the list. Looks like there's a question for Ncats. Can you, I'm gonna read it. Ncats deals with so many, I'm sorry, Ncats, is that what you're asking? Deals with so many syndromes as per the Genetic and Rare Diseases Information Center. Oh, just a comment.
That is correct, Gamal. I did say that Ncats is, kind of disease agnostics, but that said, we do have a high interest in rare diseases. So if you have any project proposing, tools or technologies that has a rare disease focus, that's also something that Ncats would be interested in.
Somebody's asked in the chat to send the link where the videos would be uploaded. So I think I did, but so it's at the NCI's website, sbir.cancer.gov. I'll just put it in again. There's an older video there now that you can go watch, but this one will be uploaded. I don't know how long it takes. Maybe a week. I think that's been my experience in the past. Is that right, Bryce? I'm not hearing him, but I think it takes about a week. So here's a question. I have a child with BBS, and it is an orphan syndrome with no research interest. Can an SBIR be a remedy? Would that be Clara? Is that an ICHD?
Yes. Can you say the disease name again?
It's BBS. I don't know what BBS is.
I don't know.
It says it's a child. It's an orphan syndrome.
And it's for child, for baby. If it is,
child,
it's NICHD's area.
Is that Bardet-Biedl syndrome? I just put in child BBS.
Patty, I'm thinking probably that question is a follow-up from the Ncats interest in rare diseases, maybe. So,
Maybe.
Right. So, the person who put in that question, I mean, if you can reach out to me with your, a write-up of your non-confidential, executive summary or specific aims, we can discuss it offline, if that makes sense.
That would be great. Kamal, please email Mina. Her email address is here on the screen. So we have a question that says, last week I presented a software-defined radio MRI system at the DXPX AACCC show that has the interest of the NIH, who called it novel. And now I'm listening to the different agencies presenting today. It looks like maybe what I am producing may be of interest to other agencies too. Should I email each of the listed AAP program managers of the 10 institutes listed? Wow. I don't know what the application of your technology is. Does this technology, can you apply it to the mission of one of the participating institutes? I think that's what you need to think about. This question is, are teenager health considered in NICHD? What's the age limit for children defined at NICHD? Can you answer that, Clara?
Yes, there's no specific policy, because the teenager is considered, or adolescent is also within the interest of NICHD. And then on the other hand, some adult disease, it could be interest of NICHD. Yeah, so, but anyway, in general, pediatric type of disease problem or babies issue are all NICHD's area.
Thank you. So Martin has clarified that your technology is MRI based. Does it have an application though in a disease area that one of the participating institutes covers as part of their mission statement? So that's what you need to think about, is the application of your technology. So hopefully you can maybe narrow it down to 2 or 3 and then email the point of contact. Well, I think we've hit our mark here. So appreciate everyone for joining. And again, we're all here to help and answer questions. So feel free to email institute contacts, or if you have questions about the Eva Garland application portal, be sure to email them at nih.aap@evagarland.com. And don't wait till the last minute to submit this application. You've got to give yourself the best chance by taking your time and filling out all the sections and giving us as much detail as possible so that we can evaluate your technology, and then hopefully you'll get a spot in this great course, and it'll help you submit a good application, a winning application. So take care, everyone. Thanks for joining, and have a great rest of your day.
Thank you.